Hello everyone, my name is Dr. Parissis and welcome to another video. In this video I want to talk about how you can tell whether you have a good donor area for hair transplant surgery. Now, of all the factors involved in hair transplant surgery, the donor area is the most important factor. This is because the donor area is where we actually take the hair follicles from and implant them into the bald or balding areas. If you don't have enough hair follicles in the donor area, then we won't have enough hair follicles to transplant into the bald areas. And if you don't have enough hair follicles transplanted in those bald areas, then you might not be satisfied with your result. So how do you know if you actually have enough hair follicles to qualify for a hair transplant? Well, the actual short answer is that you probably do. Most people do. Unless you're a diffuse thinner, and specifically a diffuse thinner that has diffuse loss within the donor area, which is quite uncommon, you probably have enough hair follicles in the donor area to support at least a small hair transplant. If you're looking for a larger hair transplant procedure requiring lots of grafts, then you're going to want to know whether you have lots of grafts in your donor area to do this. So I have developed a quick at-home test that you can do yourself to work out whether you have a below average donor density, an average donor density, a good donor density, or a great donor density. Now this is a crude test, meaning that it's not very accurate. It's not going to tell you, for sure whether you've got a great donor density or a very poor donor density, but it will give you a rough idea. And with that, you'll kind of know roughly how many grafts you can expect from your hair transplant. So the way I want you to do this, I want you to do it yourself, or you can ask a friend to take a comb, and I want you to go into the middle of the occipital area, meaning the back of the safe donor area. This is where the hair is most dense. And I want you to take the comb and just part the hair in that area. And then I want you or your friend to take a photo of what is seen. And then I want you to compare the photograph, and I want you to specifically look at the area of skin or the area of scalp that you can see. In other words, where the hair follicles are not contained. Everyone will have a certain area of skin or scalp that will be seen in this test, but people will have a different amount of skin or scalp that will be seen. And I want you to really focus on the width and the surface area of skin or scalp that you can see, and compare that to the scale which I have developed. You can see here that patients with below average density might resemble this patient here. If you have average density, then your photograph might this patient here. If you have good donor density, it might resemble this patient. And if you have great donor density, if you're one of those lucky ones, those patients that have close to 10,000 grafts in their total donor area, you might resemble this patient here. And just to clarify, the number of grafts that these patients might get, now obviously this is very, very rough and would depend on other factors as well, but I have included the number of grafts that each patient in each category might expect to be able to harvest over their lifetime. Now, this wouldn't be in one procedure. All of these graft numbers would require maybe several procedures, but you can see that there's quite a big variation between the patient with below average density all the way to the patient with great donor density. I do want to stress that this is a very crude test. It's not going to be super accurate, and really the only way to get a more accurate idea of how many grafts you might have in your donor area is to have an in-person consultation and to undergo trichoscopy, where high-powered microscope is used to really look and look between the hairs and count really how many follicles you're dealing with per square centimeter. And that way we will be able to more accurately predict how many grafts you have in your donor area, how many grafts you can use for hair transplant surgery. If you're interested in one of these consultations, and if you want a somewhat of a more accurate prediction of how many grafts you have in your donor area, don't hesitate to reach out to myself at drparissis@gmail.com. I do regular consultations with lots of patients, and looking at the donor density is just one part of the in-person consultations that I offer, amongst assessing your current state of hair loss, your family history of hair loss, how likely your hair loss is to progress, and whether you'd be a candidate for surgery as well. Once again, I'm Dr. Parissis, guys. Thanks for watching.